Our guest today is Ashley Sonney. She is the Director of Clinical Services of the Visiting Nursing Association. And Ashley, thank you for your time and thank you for being with us today on this program. We appreciate very much.
Thank you for having me.
The VNA has been around, from what I understand, from 1906 or something along those lines. It's been around for a while in Erie County, and it does a tremendous service to the people of Erie County. But can you give us a brief understanding of the history of the VNA?
I don't know as far as how far I can go back, but I
Not
believe,
to 1906, we're good.
yeah, I believe LECOM acquired it in about 2017. And it was just a great, thing to acquire for our continuum. It does a lot for our community and our continuum with the progression of care that we provide for our patients. A lot of patients, they want to be home, and we are able to provide that service for them at home to keep them home. So it really is great.
When LECOM took it over, it helped, I think, a little bit expand some of the services of the VNA to greater parts of the community. But you provide a plethora of services that I think many people are really unaware of. So can you comment on some of the services and how people can ascertain information about how to acquire those services so they can bring you into their homes?
Absolutely. So some of the services we provide to start there would be nursing, physical therapy, occupational therapy, speech therapy, home health aid, and then social work for home health. And then our other branch of hospice, we provide nursing, obviously the therapies as well, social work, bereavement, pastoral services. So there's like a whole interdisciplinary team, that we provide. To get on board with us, it's through referral. So usually that's typically from someone releasing from the hospital, or if you have a problem and you're going to your doctor, and you guys collaboratively identify a need, he'll send us a referral, or he or she will send us a referral to get that care started for you in your home. Now, home health is more of a short-term care. Hospice is its own division of care, and that's more for quality for, end of life purposes.
No, if a physician or a social worker refers a patient to VNA, you then will reach out to them, or what's the procedure or the process that they would go through in setting up, let's say, a skilled nurse or a rehab person to come to their home? And I have my referral from my physician or a social worker or an agency. They forward it to you. Then what happens?
Yeah, good question. So the referral comes to us, we work up the referral, identify the need of the patient, and then we would reach out to that patient within 48 hours to schedule a visit, or prior to 48 hours, because we want to be in the door, in 48 hours, but to schedule that visit to hit contact with the patient and to start providing that service.
So really, the turnaround is that quick, that
Mhm.
referral is given, you reach out, and then someone comes to the home. How do the people going into the home ameliorate themselves with the home environment? That's got to be difficult, I think. If I'm a family member and I have somebody there, and I have somebody I don't know from Adam coming in to visit into my personal space, my home, your folks, I guess, are trained to break down that barrier. They're trained to make themselves comfortable in their home. How does that work?
Yeah, I mean, I think we do a good job at educating our team with the community. So we use that, comfortable approach with the patient. We're very, respectful of their home and their environment, so we are going to respect like what time we need to come, what their preferences are. A lot of times when we come in, it's, do you want me to take off my shoes, or we're wearing shoe covers? It's just those personable conversations that we have with the patient to get through the door. And it's just getting to know the patient and getting to know what they're comfortable with and what they're not comfortable with to proceed with our visits.
Once they get through the door, the length of the visit obviously depends upon the length of the service or whatever service they're giving to the patient. How long they'll be in that home?
Yes, so it just depends on the indication with the length of service that we're going to provide. Our goal too with home is to educate like the surrounding family and support system so they can continue that care for the patient. And that way it's their care isn't dropped off, but that someone's educated to continue that care so that the patient, continues that quality.
Well, that point actually, I think is really well made, that this is just not a service to the patient, but part of the mission is to educate that family network or the caregiver in the home as to how to carry on once your service is done.
Absolutely.
So they're, in a sense, partners with the person coming in. They're obviously not doing it, but they're learning how they can attend to this once the period of the VNA nurse is over. Uh,
Correct.
so they should welcome that kind of collaborative approach between the visiting nurse to their home and their ability not only to administer services, but also so they can learn that skill as to how they can apply it once the nurse goes. That's a good point. I never knew that
Mhm.
there was that active component of your service to teach the caregiver how to carry on.
Yeah, teaching is a huge component of what we do, whether it be the patient or whether it be that caregiver, loved one that's there to help provide and support them. So, I mean, teaching is our number one thing that, we're doing when we go in the home.
That's a point I really did not know, and I think it's an important point to stress, that this idea that the visiting nurse is there not only to care, but also to teach that
Mhm.
caregiver how to carry on when they're done is really important. And it's a service I did not know that you did. So I hope the people who are listening and watching this really have an appreciation that somebody is just not coming in to administer something. They're coming in to help them learn how they can carry on part of it after they're complete. Is
Correct.
it the
Yep.
same person that goes to the same house, or do they switch off and on? Is it the nurse?
We, strive for continuity of care. Sometimes you do get different clinicians, but we strive for that continuity where you're, seeing who you're familiar with.
Mhm. Now, hospice is a completely different case, isn't it? Hospice care.
Correct. Mhm.
And how does that differ from the other kinds of care that you might give? Hospice is more intense and they're there more frequently.
Yeah, it's really interdisciplinary. So you have your, aides that go in, you have your social work that goes in, pastoral services, your nursing. It's really a team effort. Our goal in hospice is to make their end of life passage, to give it as much quality as we can.
And that takes a special kind of person to do that, I think.
Absolutely.
I know a few of them, and I think they're sort of like angels from above, because I do not know how some of those hospice nurses do what they do as well as they do it in obviously very difficult circumstances. So it's a real service that the VNA and you provide to those families when their loved ones are passing on. That's terribly difficult.
Absolutely. And we're able to provide that in their home. People want to be at home, they want to be with loved ones, they want to be with familiar surroundings, and we get the great opportunity to provide that for them.
I hate to ask this question, but it comes up. So how does one pay for all of this? Is it all covered by, how do you go about that? Because I think the barrier that a lot of people have is they're concerned about the financing of it. How does that end of it work?
Yeah, I mean, I can't go too far into depth with that because that's not my specialized area, but there is a Medicare benefit that people have through their insurance that sometimes that covers a portion of it, but
Mhm.
that's something that we are running and that we are doing in the back end and having those conversations with the patient and their families.
And there are people available to walk them through the financing of this particular service.
Correct, yeah, we review.
We review and help the families deal with the cost of this, because I think when you consider healthcare these days, the next question you consider is the cost of it. And people are concerned about how they afford this, and you have mechanisms available, not necessarily to pay, but surely to help people address the financial strain that this could potentially put upon a family. Is that true?
Yeah, we do the best that we can. We always encourage patients and their families to reach out to their insurances and see what their individualized plan entails. And that way, if there is any barriers or challenges that we have to talk through, or maybe we have to adjust the plan of care, that we can. So it really is a collaborative effort, with our patients. But we're always open to that communication to help and assist them any way that we can.
Now, if somebody wanted to help the VNA in terms of donations and support, would they be able to?
Absolutely. Um, we welcome the support of the community. The patients appreciate it. We've done a lot of great things with, we were talking about the Wings of Hope not too long ago. It's a great event that they put on that really captures those memories and in honor of the people who have passed. It's a butterfly release event. Um, but that, often draws those donations, to our patients in the community. But we're always welcome to those donations. Our patients are very appreciative.
And if people wanted to be so kind and gracious as just to donate something to the VNA, they could simply look up your address on the web and drop a check in the mail.
Absolutely. Yep. Drop the check at the VNA. LECOM is a great continuum. So pretty much anywhere you would take it, and LECOM, it would make it back to the VNA. But we do have envelopes, set up in certain places like funeral homes, different places in the community. We want to kind of do a bigger outreach of having those in our patient packets. And that way we're giving patients, a better opportunity to donate if they would like to.
Ashley, if someone is just driving by the VNA and has a question because they know a loved one is, let's say, in a hospital and going to come home and is going to need some care, are they capable, or are they able, or do you welcome them just stopping in and say, we have some questions, we want to talk?
Absolutely.
And then you'd walk them through the process of getting their referral, talking about the financing and how to set this all up.
Yes, I mean, we don't really get into the financing right there. That's, through our certain department that deals with that kind of stuff. But we do go through, what to expect, the services that we can provide. Maybe they don't know how to get to that first step, and we would explain, how to get there and, what they should be expecting.
And is this just Erie County? Somebody asked me that and I didn't know the question, or is it our region, your service region?
So home health reaches out to Erie and Crawford County. Hospice reaches out to only Erie County.
Just Erie County.
Mhm.
So hospice doesn't go beyond, home health care does, correct?
Correct.
How big of a staff is VNA in terms of the nurses that do go out?
I'd say accumulatively as an agency, we have about 8 to 9 RNs, and then we do have a group of LPNs as well.
And the LPNs obviously go out separately, or do they go with the nurses?
Nope, they help with those follow-up visits in the continuity care.
Well, it's a wonderful service that the VNA does. Any more you can tell us about exciting things that may be coming down the road for the VNA? Anything coming new that the audience might be interested in knowing about?
Not new, but I mean, like I said, we'll have our Wings of Hope event coming up, usually late July, early August, and we're always looking to expand that and looking to, support the community and coming to that, honoring their loved ones. So, we're looking forward to that. And like I was saying before, our goal is to, increase that quality of life for the patient, whether it be home health or hospice. And we're really trying to be proactive for the patient. So it's not just about the visits that we are currently doing. It's about providing that education to the patient to have it stick with them so they can keep having a good quality of life, and they can have that knowledge to make those good choices for their health.
And you're really blessed with special people, as we said earlier on in this interview. There are special nurses that go out and do this, and they really have a special charisma, I think, to be able to go into somebody's home, whether it's for home health care or for hospice, and administer a vital service to someone when they critically need it. So we thank you. Ashley, I thank you for your time very much this afternoon, and I especially want to thank you for what the VNA does. I knew little about it until a few years ago when I went to the first butterfly event. And then I learned about how well your nurses reach out and the wonderful service that they give to people at very difficult moments of your life. So thank you, Ashley, and thank
Thank
you
you.
VNA for all they are, all they do. And we want to encourage people to stop by, get their questions answered, if they are willing to help the VNA, to support the VNA in its critically important mission. Thank you, Ashley, for being with us today.
Thank you.